So the patient care coordinator makes the home health arrangements such as the physical therapist, occupational therapist, or the registered nurse. Now, if you are staying at a different home address during your recovery, they are the ones to be informed so that they may send a referral to wherever you will be recovering from. And they are also the people that can go over your co-payments and any benefits that you may have or what's covered. And if you need to rent an equipment or if you're covered for a walker, they will let you know and have it delivered to your home. So give them a call if you have any questions. That's 650-299-3290. And they can also provide you with any list of people that you can hire to have help at home if you can't have family members or friends help you while you recuperate. If they don't return your call within 48 hours, please give me a call and I can try and give them a call and see what's going on and help you process things along. So this is the orthopedics contact information. It has a list of phone numbers that you will contact if you have any questions or concerns. The first one is myself, and just give me a call, and if I don't answer, just leave a message and I will try to get back to you as soon as I can. Please note, I do still see patients in the clinic and also make appointments with the patients and do triage on the phone. So please be patient if I don't answer your phones right away. So if you are having a difficult time or if I'm not available, you need to get somebody, just call the clinic and one of the medical assistants will find the help to help you with any questions or concerns you may have. If you're having your knee done and you are going home with a nerve block and you have questions regarding the infusion or any problems you may be having, please call the operator for Redwood City at 650-299-2000 and ask to speak with the anesthesiologist on call because you want to speak with them regarding your nerve block and tell them about your surgery. So that way they will transfer you and you will go directly to their phone line. And if they don't answer, please leave your name with your contact information and they will get back to you as soon as they can. So if you are staying around the San Mateo area, the home health intake or the home health staff, you can call the 650-299-3940 to confirm or make arrangements regarding the home visits. And of course, for after hours, holidays, and weekends, you may call the advice nurse. Now, if it can wait until the clinic is open, we would prefer to have you wait and have you come into the clinic and have us figure it out as opposed to having you go to the emergency department. But of course, with any emergency, please call 911 or go to the emergency as soon as possible. If you are still working and you would like to apply for your state disability, just go on the link to go to the website and start filling out the form online. You could also request for a paper form that they will mail out to you and you can fill it out. And you can do this 4 weeks before your surgery date and start the process. So once you have filled out the form, you can call the number at 299-2904 and you may contact them regarding the status of your claim, or you can also call the state disability. Their numbers right there is a 1-800-480-3287 and they can let you know what the status is and what's missing and what else you need to fill out. So to wrap up, it's important for you to be at your healthiest. Make sure you prepare yourself, your body, your mind, and your home. Identify your caregiver, making sure that they are informed of what's needed of them. Actively participating during rehab so you may return to your activities. Making sure your pain is under control. You're comfortable enough to be able to participate. Um, Being on top of your pain means making sure that you are taking your pain medication as opposed to waiting until it becomes too severe. You are scheduled for a telephone visit or a video conference with me so we may go over any questions you may have. Thank you for taking this class and have a nice day. So to wrap up, being at your healthiest is very important. So if you need to do relaxation, you can use the guided meditation, continue exercising, make sure your home is safe for you to go home to. All your equipments have been assembled. You have the enhanced recovery calendar that you can refer to. It's a quick reference for you during your recovery, and also making sure that when physical therapy is at your home, to try and participate. And for you to be able to participate, your pain needs to be at a comfortable level. If your pain is too severe, you are not going to want to participate, which means delay of your rehab. So being on top of your pain, making sure that you're taking your bowel medications to prevent constipation. Those are the things you need to be on top of. If you have any questions or any concerns, we are always here to answer any of the questions. Of course, I will try and answer them as best as I can and or find the resources to help you. So good luck, and call me or email your surgeon for any questions. Quick note, if you have not done so, for patients who have a smartphone, either an Android or an iPhone, there's an app that's called My Doctor Online. It's available for you to download. I encourage you to download this app. This is the app that will allow you to email, make appointments, and also video conference with your physician, myself, or any of the caregivers that may want to speak with you face to face. Well, video face to face. And the health education department may help you figure out how to download the app. If you have any questions, you can certainly call the clinic and we can guide you as well.